Welcome everybody to Ollie's Anatomy and Physiology practice review live stream where we finally make A&P make sense. How's everyone doing today? Happy Friday. Thank God it's Friday, TGIF. We're going to do some Anatomy and Physiology 2 today. I had to go live just a little bit early today. We're going to go live at 2 instead of 3. I had something come up later, so I'm going live a little bit earlier today. We're going to be going over some Anatomy and Physiology 2 today. We're going to kind of try to cover all the topics, and then I have some bonus respiratory system questions at the end that are focused on the ions for the respiratory system, including what they affect. A lot of these questions today have been requested by you guys via that orange button down in the bottom left corner there on your screen. You can send me a message during the live stream. Let me know if you guys have any questions that you want to see come up in the live stream. Good morning. Good morning, Felicia. How are you doing? Hope you're doing well. I hope you have some fun weekend plans. But hello, everybody that's just joining. If you're new here, hi, it's nice to meet you. I'm Ollie. This is Ollie's Anatomy and Physiology practice review live stream. Thank you for the rose, Felicia. I appreciate you. Thank you so much. Glad you're doing great. Hey, how you doing, Unknown? How you doing? Hello, everybody. Welcome in. But welcome to the practice review live stream. We are here to make anatomy and physiology finally make sense for you all. We'll get started here once a couple more people filter in. But again, yesterday we went over A&P 1. Today we're going to go over A&P 2. I'm doing really great. Good afternoon, Tina. How are you guys doing? Welcome in. How is everyone doing? I know it's happy Friday. I hope you guys have some fun weekend plans. I'll be traveling back home this weekend for me. So a little bit of traveling, but hello, how's everyone doing? Welcome into the live stream, everybody. Hello, hello. Welcome back if you've been here before. It's good to see you all. Hello, hey, how you doing, Chica Red? How you doing? Awesome, awesome. All right, so real quick introduction again, and then we'll go ahead and get started with the practice questions. Hello, everybody. My name is Ollie. This is Ollie's Anatomy and Physiology practice review live stream, where we make anatomy and physiology finally make sense. We're going to go over some Anatomy and Physiology 2 today. If you see anything that you're struggling with today, I do take question requests. That's the orange button in the bottom left corner there. You can send me some topic requests that you would like to see. I'll make questions for it, and then we'll go over it in a live stream. Right now my tutoring is full, but if you are interested in tutoring, just hit the orange button as well, reach out to me. And then I have all of my notes for anatomy and physiology available on my website. That is linked in my TikTok bio. It has all my notes from A&P 2, A&P 1, and whatnot. Thank you. Hello, everybody. Hello. But we'll go ahead and get started with the practice questions now. I'm just going to flip my camera around. Bear with me for just a moment. Hello to everybody that just joined. Welcome in. Welcome to Ollie's Anatomy and Physiology practice live stream. We're going to make anatomy and physiology make sense for you all. Can everyone see the questions? Maybe zoom out a little bit. Let me know if you guys can see the questions. Once you guys say you guys can see the questions, we will go ahead and get started. Just a quick yes would be helpful, just so I can make sure the camera flipped around for you guys. Are we all good? Perfect. I got a thumbs up from Chica Red 80. Thank you. Yes from Tina. Perfect. Number one, which chamber of the heart receives deoxygenated blood from the body? It's really important that you know your blood flow through the heart. I'm actually going to make a blood flow video for you all very shortly as well. But number one, which chamber of the heart receives deoxygenated blood from the body? A, B, C, or D? All you do is type your answer choice, A, B, C, or D, down in the comments and let me know what you think it is. If you don't know what it is, that's okay. Just take a guess. But the answer is C. It is the right atrium. Remember, this is how I always practice drawing blood flow. So we have our right atrium, our right ventricle, left atria, left ventricle. And then you kind of draw your heart out rough. And then you have your vena cavas. And they drain here. They have a deoxygenated blood and it'll drain right into the right atrium. Also from the coronary veins and the coronary sinus. But number two, the mitral valve is located between the what? A, B, C, or D? These are more for they're pretty much for you to prep for the HESI and TEAS. We're already at 600 likes already, guys. Welcome in. This is prep for the HESI and TEAS. These are going to be concepts and topics that will be tested on the HESI and TEAS, and some of the anatomy and physiology undergraduate course levels. Alrighty, we're on number 2 now if you're just joining, but welcome to Ollie's Anatomy and Physiology live stream. We go live pretty much every day here covering anatomy and physiology for you all. Number 2, the mitral valve is located between answer choice B. It is the left atria and the left ventricle. The mitral valve is also the bicuspid valve. The way to remember that is whenever you go to the store and you want to try something on, you try it on before you buy it. So you tricuspid valve before you bicuspid valve. So tricuspid would be between the right atria and ventricle, and the bicuspid would be between the left atria and ventricle. Number three, which blood vessels carry oxygenated blood away from the heart? Away from the heart. Which ones carry oxygenated blood away from the heart? Not all of them, though, but the majority. So we'll say the majority of them do. So not all, but majority. I should word that question better. Sorry about that, guys. So not all of them, but the majority of them do. Or we can just get rid of this word. Let's get rid of oxygenated. So which blood vessels carry blood away from the heart? That is going to be arteries. Arteries carry blood away from the heart. Veins carry them back to the heart. Capillaries is where the gas exchange occurs. Nutrient and waste exchange occurs. Remember that, so arteries normally a lot of them do carry oxygenated blood, but the pulmonary arteries, embryonic and umbilical ones, are also examples of arteries that have deoxygenated blood. Alrighty, thanks for all the follows, everybody. Welcome in. It's nice to meet you all. We're going to move on to number 4 now. The sinoatrial node is responsible for what? If you're new here, not sure what we do, my name is Ollie. This is Ollie's Anatomy and Physiology practice review live stream, where we're going to make anatomy and physiology finally make sense for you. We go live every day covering A and B topics and other topics that you guys request as well. We are on number 4, A, B, C, or D. And we'll explain what the SA node here is in a second here. But the answer to number 4 is C. It is going to initiate the heartbeat. The SA node, or the sinoatrial node, this is what is referred to as our body's natural pacemaker. It is going to initiate the electrical impulse, giving us our heart rate, or heartbeat. All right, I'm going to move on to the next page now. Number 5, which of the following blood components aids in clotting? A, B, C, or D? Thanks for the follows, everybody. Thank you guys so much for joining us today. It's nice to meet you all. Welcome or welcome back. If you've been here before, 2,000 likes already. Hello, everybody. Welcome in. If you're new here, please feel free to introduce yourself as well. I always try to remember people's names as well, especially if you're pretty frequent in the live streams and whatnot. But we're on number 5. I'm going to move on to the next page now. But you can also watch the replay of this on YouTube as well. The majority of you are putting D, and you're absolutely correct. It is platelets. Platelets, or thrombocytes, are very critical for clotting. Again, red blood cells are for oxygen, plasma is the fluid, not clot-specific, and white blood cells are going to fight infection. Number 6, pulmonary circulation carries blood between the whats? Carries blood between the whats? A, B, C, or D? Swag said, hello, RN, 3 years here, just here for funsies. Awesome, well, welcome in. I'm glad you're here for fun. We are definitely here to have fun, too. We're here to learn A&P and do it in a fun way. We're at 3,000 likes already, guys. That's insane. You guys are absolutely crushing the like button. I appreciate it. That's awesome. Again, the more that you guys do like and share the live, the more that we can help as many people as possible on their upcoming anatomy and physiology exams and for their HESI and TEAS. This is also a fantastic review if you've taken A&P in the past and you need to brush up on it as well. But we're on number 6, and the answer, the majority of you put B, and you're absolutely correct. That is the heart and lungs. Pulmonary circulation carries blood, carries deoxygenated from the heart to the lungs, and then oxygenated blood back to the heart. Number 7. Thank you, Snakes, for the roses. I appreciate the gifts, guys. Thank you so much. I appreciate that. Number 7, the thickest layer of the heart is the what? The thickest layer of the heart is what? Of the heart wall. Which one is that one? Think about which one that would make sense for when you're thinking about the function of the heart itself. A, B, C, or D? Thank you, guys. Let's see what you guys think. A majority of you are putting B. If you put B, you're absolutely correct. It is the myocardium. Remember that myo means muscle, so muscle of the heart. Endo means inside. Peri is covering, and then we have our epi, which is above. So again, that myocardium is that muscular middle layer responsible for contractions. It's the thickest layer because it's responsible for getting blood out to the rest of the body. Number 8. Number 8, the function of hemoglobin is to what? What does hemoglobin do? A, B, C, or D? We're at 6.3 thousand likes already, guys. That is insane. Thank you, guys. You guys are crushing it. Oh my goodness, welcome in. Thanks for the follows as well. If you're new here, welcome. We're going to go live every day covering anatomy and physiology for you all. And you can request topics via the bottom left corner there, that orange button there. If you have any topic you're struggling with, a lot of these questions are coming from you guys. I make questions based on what you guys say you're struggling with for A&P. The answer is B. It is to carry oxygen. The majority of you put B. You're absolutely correct. Hemoglobin in red blood cells is what binds to oxygen. Number 9, which gland is considered the master gland of the body? A, B, C, or D? I Love K says, thank you for all you do. Let me see. Sorry, the comment went away. I didn't see the rest of it. Thank you for all your lives. It's a great practice. Thank you for being here, Kay. It's good to see you again. I hope you're doing well. I hope you have a good Friday and a good weekend coming up. Same with the rest of you. Awesome. But welcome in, everybody. We're at 8.5 thousand likes already. You guys are crushing it. We're doing some anatomy and physiology 2 today. For HESI, this is majority for the HESI or TEAS, but again, this is great for A&P or any exams that's going to have anatomy and physiology on it. But number 9 is going to be C. It's going to be the pituitary. It is referred to as the master gland because it controls a lot of the other endocrine glands. There's one that's called the master regulator. That is the hypothalamus. Mainly because it regulates the pituitary and a lot of other of our endocrine functions through releasing and inhibiting hormones. All right, we're going to move on to the next page now. Number 10, the hormone insulin is produced by what? And as we move on to the next page, if you missed anything, you can watch the replay on YouTube. It's linked in my bio. But again, as we move on to the next page, I just want to welcome everybody else who just joined. It's nice to meet you. Welcome to Ollie's Anatomy and Physiology Practice Review live stream. This is where anatomy and physiology will finally make sense for you. Everything that I'm going over today, you can get on my my A&P notes. They're on my TikTok bio. They're linked in my TikTok bio on my website. They're clear, condensed, and concise, so you can easily study with them. We're going to move on to number 10 now. We're at 11,000 likes. Let's go. But the answer to number 10 is C. It is the pancreas. Insulin, specifically, is made by the beta cells of the pancreas. The beta cells of the pancreas. Number 11, which hormone regulates metabolism? Which hormone regulates metabolism? Pretty much whenever you're hearing about the endocrine system and metabolism, you can almost automatically think of this. So let me know what you guys think. A, B, C, or D. What do you think it is? We're at 12,000 already. That is insane. 12,000 likes. You guys are absolutely crushing it. You guys are majority of you are putting A, and that is absolutely correct. Thyroxine, you can think of the thyroid gland in general whenever you hear metabolism. You can think of the thyroid gland whenever you hear metabolism in general. But thyroxine is T4, triiodothyronine, that's going to be T3. Number 12, the adrenal medulla secretes what? A, B, C, or D? This in particular isn't one that students miss, but whenever I ask another version of this question, students miss it. So I'm going to have you guys answer this question, and I'll give you the other version of the question that I can ask. Can I do cranial nerves? Yes, I will. I would do that in the next live. I'll ask you the other version of this question once you guys answer this one. I'm seeing a lot of C's, and you're absolutely correct. It is going to be C. It's going to be epinephrine. So a question that I ask that is similar to this is, what does the adrenal cortex secrete? And whenever I ask this question, a lot of people still say epinephrine, but that is not true. The adrenal cortex will secrete aldosterone and cortisol. Those are adrenal cortex hormones, and again, insulin comes from the pancreas. The way that I kind of think about that, think of the cortex has core in it, cortisol has core in it. That's how I always kind of think of it. And aldosterone has 2 O's and there's an O. That's how it's just a little silly, dumb way to remember. But again, a lot of students get those mixed up. So I always try to make sure I kind of talk about both, the adrenal medulla and the adrenal cortex. So again, medulla, epinephrine, and norepinephrine. I'm just going to put norepi for this. And then cortisol is aldosterone and cortisol. Number 13, I'm going to move on to the next question now. Thank you, Mono, for the roses. Thank you for the gifts, guys. I appreciate that. Antidiuretic hormone, ADH, primarily affects what? ADH primarily affects what? And a lot of students get ADH and another hormone mixed up as well, which I'll go over in just a minute once you guys answer this one. But we're at 13.4 thousand likes already. That is insane. Welcome to everybody that just joined. Welcome to my anatomy and physiology practice reviews. I'm going to go live pretty much every day covering A&P, and then you can also request questions via the bottom left corner there on that orange button. You can send me a request during the live stream as well. I'm happy to take requests. We do more than just anatomy and physiology here as well occasionally. So if you want any extra help, please hit that orange button. Let me know what you want to see. But we're on number 13 now. Antidiuretic hormone is primarily going to affect B. It is going to be kidney water reabsorption. ADH is going to increase the water reabsorption or water retention in the kidneys. A lot of students get this mixed up with aldosterone. And the reason being is because it does affect water reabsorption at the kidney, but also it does it indirectly. This is going to increase sodium resorption, and then water follows sodium. Okay? Number 14, which hormone stimulates milk production in mammals? Key thing here is production. And then there's another one. There's ejection as well, which we'll talk about. A lot of students get if I were to ask the other thing of ejection here, we can see what that one is going to be. But A, B, C, or D. What do you guys think? A, B, C, or D? But welcome in. Thanks for all the follows, everybody. We're 15,000 likes already. That is absolutely insane, guys. Thank you guys so much. The answer is going to be B. Is going to be prolactin. So prolactin is responsible for producing milk. Ejection is going to be responsible from oxytocin. So prolactin will produce it, oxytocin will eject it. I'm going to move on to the next page of questions now here, everybody. Number 15, parathyroid hormone is going to increase what? Parathyroid hormone will increase what? And then which hormone would decrease what it would increase? If you want to throw in a little extra there. If you have a little extra in you. Real quick while we're waiting here. We're at 16.8 thousand likes already, guys. Thank you guys so much. I really appreciate you guys. That's absolutely incredible. Thank you all so much for being here. Awesome. Welcome. There's over 900 of you in here now. Thank you guys so much for being here. I'm Ollie, by the way. I have my master's degree in molecular medicine, and I go live every day covering anatomy and physiology for you all, as well as other topics. You can request those via the orange button at the bottom left corner there. I'd be happy to put them in a live stream. Number 15, parathyroid hormone increases calcium absorption. It is going to raise our blood calcium levels. It responds to low blood calcium levels. Calcitonin will respond to high blood calcium levels to lower it. Okay? Perfect. Number 16, which of the following is not an endocrine gland? A, B, C, or D? If you are new here, just put your answer choice down in the comments. Just comment A, B, C, or D. Whatever you think the answer is. If you don't know, just put your best guess. But welcome in, everybody. We're 18.5 thousand likes already, guys. It is absolutely insane. Thank you all for being here. Thanks for participating. I absolutely love doing these live streams. I do them every day for A&P and then other things that you guys request. But the answer is C. It is liver. The liver does have our metabolic and detoxification functions, but it is not primarily endocrine. The thyroid, pancreas, and adrenal are all hormone-producing glands. Number 17, gas exchange occurs where? Where does that occur in? Specifically, where is that going to occur? A, B, C, or D? What do you guys think the answer choice down in the comments? We're almost at 20,000 likes on the live stream already today, guys. This is absolutely insane. Happy Friday. I hope you guys are already having a good Friday. I hope after the live stream today, you guys have a fantastic Friday and a fantastic weekend. But number 17, gas exchange is going to occur in the alveoli. In the alveoli, this is where we're going to see our oxygen and our carbon dioxide exchange. Number 18, the diaphragm contracts during what? When is the diaphragm going to contract? We have over 1,000 people in the live stream. Guys, that is insane. That's the first time we've ever hit 1,000 viewers in a live stream. That's incredible. Thank you all so much for being here. Thanks for being a part of my first ever 1K live stream. That is incredible. Thank you, Extra Big Thick, for the roses. Thank you so much. Good to see you again. Thank you all so much for being here. 21,000 likes on the live. That's incredible. Number 18, the diaphragm contracts during inspiration. And then a lot of students get mixed up here with expiration and exhalation. This is when the diaphragm relaxes, so not contracts. Number 19, which part of the brain regulates breathing rate? A, B, C, or D? Thank you, Looks by Lonnie, for the rose. Thank you guys so much for the gifts, and thanks for being here. I appreciate you guys. Welcome to Ollie's Anatomy and Physiology Practice Review live stream, where anatomy and physiology is finally going to make sense for you. Thank you, Extra Big Thick, again for the roses. Appreciate you being here. Good to see you again. We're at 23,000 likes. I also try to remember people's names as well, especially if you're a pretty frequent viewer on the live streams as well. Thanks for the follows as well, guys. You guys are absolutely incredible. The answer is going to be B, the medulla oblongata. The medulla is going to control our involuntary respiration, meaning that we don't have to rest. We don't have to think about our respiration. The cerebrum will actually be what is our voluntary respiration when we think about it, and we're consciously like, breathe. I don't know if you can hear me breathing, but anyway, number 20, we're going to move on to the next page of questions here now. Oxygen is transported in the blood primarily by what? A, B, C, or D? What do you guys think it is? A, B, C, or D? We're at 24,000 likes already, guys. That is insane. Thank you all so much for being here. This is my first ever 1,000 viewer live stream. That is insane. Thank you for doing this. Yes, no, thank you for being here. Seriously, thank you guys for being here. I couldn't do it without you guys. So really, truly. I'm going to move on to the next page. Again, if you've missed anything or you joined a little late, the replay will be on YouTube afterwards. It's linked in my TikTok bio. Number 20, the answer is B, hemoglobin. Oxygen will bind to hemoglobin to be transported. There is a little bit of oxygen in the plasma, but not very much. Number 21, what structure prevents food from entering the trachea? What is that going to be? A, B, C, or D? Put whatever you think the answer choice is down in the comments. A, B, C, or D. Or 1.2 thousand viewers, 26,000 likes. Let's go. This is an insane live stream, guys. That's absolutely incredible. Thank you so much for being a part of this. But number 21, the answer is going to be C. It's going to be the epiglottis. Going to be the epiglottis. So the epiglottis covers the trachea when you swallow. The uvula is going to help a little bit with closing your the nasopharynx. The nasopharynx. Number 22, the voice box is also known as what? Thanks for the follows, everybody. Thank you guys so much. 1.3 thousand viewers. That is insane. That's absolutely incredible, guys. But number 22, the voice box is also known as what? A, B, C, or D? A, B, C, or D? We're almost at 30,000 likes already. That is insane. Thanks for the follows, everybody. The answer is going to be B. It's going to be our larynx. It's going to be our larynx. The larynx houses our vocal cords. Again, the trachea is the windpipe. Pharynx is part of the passageway of our throat. Bronchus are our airway branches. Number 23, the tiny hairs in the nasal cavity that help filter air are called what? They're going to help filter our air. What are those called? A, B, C, or D? Let me know down in the comments. Also, everything that I'm covering in today's live stream are available in my anatomy and physiology notes. They are linked in my TikTok bio for you all. 31,000 already, guys. That is insane. Number 23 is B. It is cilia. It is cilia. Cilia are going to trap and move particles out of the airway. The villi are in the intestines. Alveoli are going to be for the gas exchange. And bronchioles are our airways. Number 24, where does most... Again, keyword here, most nutrient absorption occur. A, B, C, or D. We're kind of moving on to some digestive system questions now for anatomy and physiology too. Again, welcome to the live stream, everybody. If you're new here, this is Ollie's anatomy and physiology live stream. We're finally going to make anatomy and physiology make sense for you all. I'm Ollie. I have my master's degree in molecular medicine. I've been tutoring anatomy and physiology for 5 years now, and I go live every day covering A&P and other topics that you guys request. Number 24, the answer is C. It is the small intestine. It is the small intestine. Specifically let me switch my red pen on tonight like Lana Del Rey. The jejunum is going to absorb a majority of the nutrients. Again, large intestine is for water absorption. I'm going to move on to the next page now, everybody. Number 25, the enzyme amylase is going to begin digestion of what? It's going to begin digestion of what? You also have your salivary and your pancreatic amylase. A, B, C, or D. What do we think that is? Fantastic. All you put in carbohydrates, you're absolutely correct. Salivary amylase is going to be in your mouth. Pancreatic amylase gets released from your pancreas. Number 26, which organ produces bile? Moving on to the next page now. Again, you can find the replay on YouTube if you've missed anything. It's linked in my TikTok bio as long as with my notes as well. For A&P, number 26, which organ produces bile? A lot of students get this question a little bit tricked up here. Which organ produces bile? A, B, C, or D? Fantastic. It's the liver. A lot of students think that it will be the gallbladder. Why is that one wrong? Why is that one wrong for number 26? Anyone tell me? But basically here, the gallbladder stores and releases bile. It does not produce it. Just because it stores it and releases it does not mean it produces it. The liver is what produces it. This, again, bile is going to help emulsify fats for lipase to break it down even further. Number 27, the major function or the main function of the large intestine is what? I gave that answer away a couple questions ago, so let's see if you were paying attention for that one or if you know the answer. Just comment your answer, A, B, C, or D. We're almost at 40,000 likes already on the live stream, guys. That is absolutely insane. That is absolutely insane. Thank you guys so much for being here. We have 1.3 thousand viewers. This is my first ever live stream, over 1,000 viewers. But the answer is going to be B if you were paying attention. It is water absorption. The majority of the nutrient absorption was going to occur in the small intestine. Whatever is left in that indigestible matter, water will get absorbed from it. That's what's going to give us our solid feces. Number 28, what structure connects the pharynx to the stomach? A, B, C, or D? A, B, C, or D? 1.4 thousand, we're at 40,000 likes. Thank you guys so much. I'm so happy. That is awesome. That is awesome. 1.4 thousand viewers as well. That is insane. I've never had this many people in a live stream before. Welcome in, everybody. If you're new here, my name is Ollie. I'm going to be going live every day covering anatomy and physiology for you all. In these practice review live streams, we're going to make anatomy and physiology finally make sense for those of you who are struggling with it, or if you need a review, if you've taken A&P in the past and don't remember too much. But 28, the structure that is going to connect the pharynx to the stomach is going to be C. It's going to be the esophagus. The esophagus is what transports food from the pharynx to the stomach. Number 29, which part of the digestive system secretes hydrochloric acid, or HCl? Which part of the digestive system will secrete that? A, B, C, or D? Thank you all so much for the participation. Thanks for being here. Everybody, 46,000 likes already. You guys are absolutely crushing that like button. That is insane. We've only been live for like 26 minutes, and there's already 46,000 likes. You guys are crushing it. Thank you. Seriously, I absolutely love doing these live streams, so any support in doing this just means the world to me. Number 29 is D. It is the stomach. The stomach, specifically the parietal cells in the stomach. I'll write these out here for you. The parietal cells in the stomach secrete hydrochloric acid to aid in digestion. The small intestine, again, is for the nutrient absorption. Pancreas will secrete enzymes and bicarbonate. Bicarbonate will help neutralize the acidic acid a little bit. Liver will produce bile. Number 30, if you've been paying attention, the gallbladder stores what? What does the gallbladder store? A, B, C, or D? Also, the cat just came in. His name's Elvis. If you stick around to the end of the live stream, I'll put Elvis up on the camera. We have two cats, Elvis and Seymour. But number 30, the answer is B. It is bile. Remember, the gallbladder stores it. It does release it. Bile is produced by the liver, though. Bile is produced by the liver. The gallbladder stores it and also releases it. Number 31, we're going to go to the next page of questions here now. The functional unit of the kidney is what? Again, functional unit is the smallest but the largest unit of structure possible for a certain system to undergo its function. Which one would that be? A, B, C, or D? 56,000 likes. I swear, I look away and there's like another like 5 or 10,000 likes in the live already. That's insane, guys. Thank you guys so much for being here. Thank you guys so much. Number 31. The answer is B. If you put nephron, you are absolutely correct. A lot of students get this one mixed up a little bit with the glomerulus. The glomerulus is part of the nephron. It is not the entirety of the functional unit. And we'll kind of talk, I think there's a question a little bit later on about the function specifically of the glomerulus. But the ureter, we'll talk about that a little bit too later on, some other questions. But the renal pelvis does collect the urine. But 32, the urine is carried from the kidneys to the bladder by the what? What is the structure that is going to carry urine from the kidneys to the bladder? A, B, C, or D? Put whatever you think the answer choice is down in the comments. Comment A, B, C, or D. Oh my gosh, we're at 61,000. We're at 1.5 thousand viewers. Oh my god, I'm serious. This is the most amount of people I've ever had in a live stream. I have never even had over 1,000 before. 1.6 thousand. Hello, everybody. Hello, everybody. Everybody that just joined. Hi, it's nice to meet you. I'm Ollie. I do anatomy and physiology practice review live streams. I really want to make anatomy and physiology finally make sense for you, or review it if you've taken the past and you don't really remember things. But I go live every day covering A&P topics and other stuff as well. You guys can request that in the bottom left corner there. It's like that orange button. You can send me a topic request for live streams. I'll make questions on it. A lot of the questions here today are from you guys. Thank you, Laura, for the rose. Number 32, the answer is going to be the ureters. The ureters are going to transport urine from each kidney to the bladder. And then the urethra is what takes the urine from the bladder to the external environment, which is hopefully a toilet, please. Number 33, what structure filters blood in the nephron? A, B, C, or D? Whatever you think the answer is, put it down in the comments. A, B, C, or D. 1.7 thousand viewers in here, 70,000 likes. You guys are absolutely crushing it. Thank you so much, everybody. I'm so happy you're here. And 1.8 thousand viewers. Hello, everybody that just joined. I'm Ollie. I have my master's degree in molecular medicine. It's nice to meet you. Please feel free to introduce yourself to me. I always love meeting new people. I try to remember everybody's name from the lives as well, but I've never had this many people in here before. Thank you all for being here. Seriously, this is a record for me. So thank you for being a part of my first ever 1,000 viewer live stream. Number 33, what structure filters blood in the nephron? The answer is the glomerulus. Like I mentioned earlier, the entirety of the functional unit is the nephron. The glomerulus is part of the nephron that filters the blood in the It's the capillary network where that filtration of blood begins. Number 34, which hormone increases water reabsorption in the kidneys? This is kind of a repeat question if you've been here a little bit earlier, but I do try to ask this question. A lot of students get this hormone, they get these two hormones confused. So I'll let you guys answer and I'll kind of explain the difference here. For number 34, the answer is going to be B. It's going to be ADH, antidiuretic hormone. This is going to increase water reabsorption directly. Aldosterone is going to increase sodium reabsorption, and then water follows it. So water is indirectly. So again, ADH is direct, aldosterone is indirect. Again, aldosterone is going to increase sodium, water follows sodium. A lot of students get that mixed up, so hopefully this helps you kind of remember. I always try to answer that one, kind of try to answer that question a little bit. A lot of students get those mixed up. Number 35, I'm going to move on to the next page now. What is the correct order of urine flow throughout the urinary tract? A, B, C, or D? And as we move on to the next page, if you've missed anything or you joined a little late, I do post every single replay of every single live stream on YouTube. The link is in my TikTok bio. Everything we cover here as well as in my anatomy and physiology notes. If you need some extra help, they are also linked in my TikTok bio. Number 35, the answer is going to be B. It goes from the kidney to the ureter, to the bladder, to the urethra. So you have your kidneys, your ureters, your bladder, and then your urethra is kind of what this essentially looks like here. That's the correct flow and pathway. Number 36, the urinal cortex will contain what? What do they contain? A, B, C, or D? A, B, C, or D? What do we think in the comments? A, B, C, or D? For number 36, the renal cortex contains what? Fantastic. 83,000 likes on the live stream. You guys are absolutely crushing it. That is insane. Thank you guys so much. That is incredible. That is absolutely incredible. It's going to be C. It's going to be the glomeruli. So the renal cortex will contain the glomeruli, the loop of Henle, the collecting ducts, and the renal pyramids. These are all located in the renal medulla. Number 37, which waste product is formed from the breakdown of proteins? A, B, C, or D. Thanks for the follows, everybody. If you're new here, I'm going to be going live every day covering A&P for you all. Thank you all so much for being here. I absolutely love doing these live streams, so I do appreciate you guys being here. This is the most ever viewed live stream for me. This is a record for me, so thank you for being a part of that today on a Friday of all that. TJIF, thank God it's Friday, right? I hope you all have a great Friday and a weekend as well after this. But 37, the answer is going to be B. A lot of you are putting B. You're absolutely correct. Urea. Urea is produced from protein metabolism in the liver, and then it gets excreted by the kidneys. Glucose would be from carbohydrates. Ketones would be from fat metabolism. Creatine is more so in muscle energy, not really in protein waste. Number 38, lymph is most similar to what? A, B, C, or D? Lymph is most similar to what? Thanks for all the follows, everybody. Thank you guys so much for being here. I start this course next year. Awesome. I will be doing this next year as well. I'm going to keep doing this for the foreseeable future. 90,000 likes. That is insane, guys. Thank you guys so much. This is hard. Well, hopefully, if you keep joining the live streams, eventually this will get a lot easier. Again, my name is Ollie. This is Ollie's Anatomy and Physiology practice review live stream, where I am going to finally make anatomy and physiology make sense for you. If you've taken A&P in the past as well, hopefully this is fantastic review for you to connect those dots that were there, but they're a little rough. But number 38, the answer is blood plasma. Lymph is most similar to blood plasma because lymph originates from the interstitial fluid and has a very similar composition to plasma. Cerebral spinal fluid, that is what surrounds your brain. Spinal cord, bowels, and the liver. Urine is what gets excreted. It's not going to be part of that. Lymph nodes function to what? What is the function of lymph nodes in anatomy and physiology? What do we think? A, B, C, or D? A, B, C, or D? Let me know what you guys think down in the comments. A, B, C, or D. Let me know what you guys think down in the comments, A, B, C, or D. What is interstitial fluid? Interstitial fluid is the fluid that like surrounds the cells and the tissue. Or D. What is interstitial fluid? Interstitial fluid is the fluid that like surrounds the cells and the tissue. Particles, again, they're part of your immune system. Number 40, the largest lymphatic organ is going to be what? We're going to move on to the next page now. The largest lymphatic organ that is what? Out of these four choices, A, B, C, or D, the thymus, tonsils, spleen, or appendix, which one is that going to be? The majority of you, I see a couple different ones here. I'm seeing a lot of C's and A's. The answer is going to be C. It is the spleen. The spleen filters blood and lymph. It recycles your old and damaged red blood cells and supports your immunity function. The thymus is important, yes, but again, the thymus actually decreases in size as you get older. So it's big, large, and active when you're a child, and then during puberty and stuff, and by the time you're an adult, it's very small. So the spleen is the largest lymphatic organ. Number 41. 100,000 likes. I just saw the comment. Thank you, guys. Number 41. Which type of cell is responsible for antibody production? We're at 101,000 likes. That is insane. That is literally insane. We've only been here for like 30 minutes. That is insane, guys. Thank you guys so much. I appreciate all the likes. It means the absolute world to me. Thank you guys so much. I really am just here to help you guys in anatomy and physiology and all your other classes and stuff. I really just want to help you not only just pass, but ace your classes too. I really want to help you understand and learn this stuff. But number 41, the answer is a B cell. It's kind of in the name here. And a body has a B in it, so body. Number 42, the thoracic duct drains lymph from where? And in terms of the answer choices on the last question for number 41, the T cell it's cell-mediated immunity. Macrophage undergoes phagocytosis, and neutrocells are your first responder type of white blood cells. So those are not responsible for antibody production. But number 42, the lymphatic duct drains lymph from where? The answer is going to be B. It's going to be from your left leg. The thoracic duct will drain the entire lower body and left upper body into the left subclavian vein. A, C, and D, right arm, right side of the chest, and right side of the head. These are all done by the right lymphatic duct. So that's a key difference between the thoracic duct and the right lymphatic duct. Okay? Number 43, the thymus is most active when? Let's see if you were paying attention. Number 43, the thymus is most active when? I just went over that. A, B, C, D. We're at 109,000 likes. That is insane. Thank you guys for all the follows as well. I always love seeing new faces around here as well. But thank you guys so much. I really appreciate you all. Thank you guys so much. But number 43, the thymus is most active. B, during puberty. So again, the thymus is largest and it's most active in childhood and early adolescence, and then it'll atrophy, which means it decreases in size as you become an adult. Number 44, sperm is produced in the what? Where is sperm produced? A, B, C, or D? We're going to move on to some reproductive system questions now, everybody. A, B, C, or D? We're at 113,000 likes. Oh my goodness, that is insane, guys. Thank you. Oh my goodness, that is insane. 1.6 thousand viewers, too. Like I said, this is my most ever viewed live stream. I've never gotten over 1,000. I think we got up to like 1.8 thousand. That is insane, guys. But again, if you're new here, welcome. My name is Ollie. I'm going to be going live every day covering anatomy and physiology for you guys. And I also do other ones as well. You can request those in the bottom left corner there. But the answer to number 44, the answer is going to be D. It's going to be the seminiferous tubules. Those are located in your testes. This is essentially where spermatogenesis occurs, so where sperm gets produced. And we'll talk about the other ones later on in some of the other questions. We're going to move on to the next page now. Number 45, the release of an egg from the ovary is called what? What is that called? A, B, C, or D? But like I said, the other answer choices, we have questions on those later in the live stream. So we'll go over those shortly. But number 45, the release of an egg from the ovary is what? Put your answer choice down in the comments, A, B, C, or D. And number 45 is going to be B. It's going to be ovulation. Ovulation is where the egg is released during the menstrual cycle. Again, fertilization is where the sperm and the egg meet. That is their union. Menstruation is the shedding of the endometrial lining, and implantation is the embedding of a fertilized egg into the uterus. Number 46, moving on to the next question now, scrolling up. Number 46, which hormone promotes the thickening of the endometrium? Promotes the thickening. When I say promote, let's say I could use a better word here. Which one maintains? Because there's two hormones here that are kind of involved in this. One hormone builds it up and one hormone maintains it. So which one would that be? A, B, C, or D? Majority of you are saying C. You're absolutely correct with that one. Again, progesterone is going to help promote and maintain the thickening of the endometrium. The estrogen is going to build it up. So it builds it. And then testosterone is more so with male sex hormones. Follicle-stimulating hormone will stimulate follicle growth. Number 47, the structure that carries sperm from the epididymis to the urethra is the what? A, B, C, or D? What do we think that is? A, B, C, or D? The structure that carries sperm from the epididymis, that's where sperm is stored and matured, to the urethra is what? It's A. It's the vas deferens. It's the vas deferens. All right? Okay. Number 48, where does fertilization typically occur? Where does fertilization typically occur? A, B, C, or D? A, B, C, or D? What do we think? What do we think? Where does fertilization occur? A, B, C, or D? The answer is D. It's the fallopian tube. It's the fallopian tube. It is specifically at the ampulla. Specifically at the ampulla. So fallopian tube, again, is where the sperm meets the egg. All right, moving on to the next set of questions here on the next page. Remember, you can watch. I have two questions here, and then I have some bonus respiratory system questions. So we'll answer these two real quick, and then we'll move on. I have some bonus respiratory questions that are focused on ions and hormones of the respiratory system. Number 49, what structure produces testosterone? What is that going to be? Which ones do that? A, B, C, or D? A, B, C, or D. We're at 126,000 likes. That is insane, guys. That is absolutely insane. That is insane. Oh my gosh, that's incredible. That is incredible. Number 49 is B. It is Leydig cells. Leydig cells are going to produce testosterone. They're found in the testes. Number 50 real quick, and then we'll move back to those bonus respiratory system questions. Number 50, the female structure. Homologous to the male penis is the what? A, B, C, or D? What do we think it is, guys? A, B, C, or D? Which one? Perfect. The majority of you said C. That is absolutely correct. It is C. It is the clitoris. The clitoris develops from the same embryonic tissue as the penis. All right, bonus questions here, guys. I added some bonus questions. A lot of you guys have been requesting some more respiratory system questions, so I added an extra 10 here. Number 51, which ion plays a key role in maintaining the acid-base balance of blood during respiration? What is that going to be? A, B, C, or D? What do we think? What do we think? A, B, C, or D? A, B, C, or D? We're at 130,000 likes, guys. That is insane. Perfect. You guys are absolutely crushing it. You guys are crushing it. A, B, C, or D. Perfect. It is B. It is bicarbonate. Bicarbonate, or our HCO3 negative, acts as a buffer, helping to maintain our blood pH. It neutralizes the excess hydrogen ions. It's produced when carbon dioxide combines with water via that carbonic anhydrase. All right. And then number 52, what hormone is released by the adrenal cortex in response to low blood volume, and it indirectly affects respiration by altering blood pressure and perfusion? A, B, C, or D? These are some more questions that kind of like, they very much help you, a little more in-depth questions here for the respiratory system. I've gotten a bunch of messages via that orange button there if you have any topic requests about it. A lot of people who have been struggling with some of these questions. The answer is going to be A. Again, aldosterone is produced by the adrenal cortex, like we went over earlier in the live stream. It is released in response to a low blood volume, but aldosterone is going to increase sodium reabsorption. So increase our sodium reabsorption, which is going to increase our blood volume and our pressure. And this is going to indirectly support our oxygen delivery and balance. Number 53. We're on to number 53. The enzyme carbonic anhydrase is crucial in the respiratory system for the conversion of what? The conversion of what? I just mentioned this one. We just went over this, so hopefully you were paying attention. Again, the enzyme that we just covered like 2 questions ago, the enzyme carbonic anhydrase is crucial in the respiratory system for converting what? Perfect. You put B. You're absolutely correct. That is carbon dioxide and water into carbonic acid. All right, number 54. Number 54. Which ion is exchanged for chloride in the chloride shift in red blood cells during CO2 transport? Excuse me, I had a hiccup. Number 54, what is that going to be? This one should be pretty easy as we know what is responsible with red blood cells and carbon dioxide transport. The answer is also going to be bicarbonate again. Again, our bicarbonate exits red blood cells into the plasma as chloride enters it. That is that chloride shift. That helps maintain the ionic balance there. We're going to move on here to the last couple of questions here. Number 55, which hormone stimulates an increase in the respiratory rate? By acting on central chemoreceptors in response to an elevated carbon dioxide level A, B, C, or D. A, B, C, or D. Callie said so smart. I love this. Awesome. I'm glad you love this. Thanks for being here, Callie. Thank you guys for being here. I really appreciate you guys being here. Awesome. 137,000 likes. You guys are absolutely crushing it. We're on number 55 now. We're on number 55. Number 55, the answer is D. No hormone directly. So no hormones are responsible for this. Chemoreceptors are what respond to pH changes. So there's a little bit of a trick question there. Number 56, during hypoventilation, which ion concentration increases in the blood, leading to respiratory acidosis? A, B, C, or D. Thank you, Angel, for the gift. Thank you guys so much for the gifts today. If I missed you giving a gift, thank you so much for doing that. They mean the world. Any support in doing these live streams, it means the world to me. They're my absolute favorite thing in the world. Number 56, the answer is going to be B. It's going to be hydrogen. It is hydrogen. Hypoventilation causes buildup of carbon dioxide, which would give more carbonic acid. Hydrogen would lower pH, giving us our acidosis. Number 57, antidiuretic hormone indirectly affects respiration by what? By what? A, B, C, or D? Thank you, Nisa, for the rose. Thank you so much. I appreciate the gifts, guys. That is absolutely fantastic. Number 57, the majority of you are putting C, and you're absolutely correct. You guys were paying attention earlier. I can tell that now. That is awesome. It's going to promote water retention and increasing our blood volume. Again, antidiuretic hormone will indirectly affect respiration by promoting our water retention, thus increasing our blood volume. Number 58. Which of the following hormones can cause bronchodilation, improving airflow during sympathetic activation? A, B, C, or D? Antidiuretic hormone causes the kidneys to retain water, and when you retain water, you are increasing the water in your blood, therefore increasing blood volume. That actually improves perfusion in tissues, especially the lungs. Again, so directly with water, indirectly with respiration. Number 58, the answer is B. It is epinephrine. Epinephrine binds to beta-2 adrenergic receptors on smooth muscle in bronchioles. That causes bronchodilation. This is super helpful. I have the TEAS next week. But also, yes, awesome. Good luck. Good luck on your TEAS. If we could get good luck in the chat as well, that'd be absolutely fantastic. I love wishing people good luck who have their TEAS and other exams coming up. Last two questions here. Number 59. In metabolic alkalosis, which respiratory adjustment is typically made to help compensate? What is going to compensate for metabolic alkalosis? A, B, C, or D? Perfect. Thank you guys for putting good luck in there. Studying for my MCAT. This is great, Kat. Good luck on your MCAT. Can we get another good luck in the chat for Kat as well? Thank you guys so much for doing that. I appreciate that. We love 143,000 likes. That is insane. I just took a look at that. Awesome. I'm glad this is helping you guys. Thank you guys so much for letting me know. I'm so happy you're here. The answer is C. It is going to decrease in respiratory rate. So slower breathing retains carbon dioxide. That would increase our hydrogen to offset a higher pH. So that's our compensatory hypoventilation. Number 60. Last question here, everybody. And then I will flip the camera around and say hello to everybody. Answer a couple quick questions. But number 60, which ion's extracellular concentration is closely monitored by chemoreceptors to maintain normal respiratory function and pH? A, B, C, or D? What is that going to? Again, when we're talking about pH, we'll be talking about the measurement of which kind of ion. Please do urinary system. Yes, yeah, we'll do some urinary system stuff. We did a little bit today. We'll continue doing that as well. All right. Number 60. Last question. The answer is C. It is hydrogen. Remember, when we're talking about pH, we're talking about the measurement of hydrogen ions. So chemoreceptors in the medulla will monitor the hydrogen concentration in our cerebrospinal fluid. That will reflect the carbon dioxide levels. That will regulate ventilation. Alrighty, everybody, thanks so much for joining the live stream again today. Tomorrow, I will be live again at noon Eastern Standard Time. I was going to do a live stream tomorrow, but so many of you are here that I'm happy to do this. I'm going to go live tomorrow at 12. I won't be going live on Sunday, but I'll be going live again on 3 p.m. on Monday, 3 p.m. Eastern Standard Time, 12 p.m. tomorrow. I'm going to flip the camera around here and say hello to everybody. Give me just a moment. Hello, everybody. Hi, I'm Ollie. I'm the guy who's just been yapping to you about anatomy and physiology for the last hour if you've been here the whole time. Thank you all so much for the gifts, everybody. Thank you so much. Thank you. You're watching in France. That is insane. Thank you so much, Jan. Thank you, guys. Thank you, Jessica. Thank you, Kat. Thank you. Can I also go with Fluid? Yes, I absolutely can. Thank you for the heart pup. Thank you, Callie. Thank you, Queen Tiffany. Thank you, Lara. Thank you, Eva. Thank you, Annalie. Thank you, Morgan. Watching from Spain. That's insane. France, Spain, like that is insane, guys. This is, first of all, I just have to say, you guys are saying thank you, but yes, 12 p.m. Eastern Standard Time. You can actually register, or you can put on my notifications on my profile. They're linked in my, if you go to my profile and put the bell on, California, that's insane, that's across the countries. Athens, Greece. I'm from America, I'm from the U.S., I just joined past my TEAS. Awesome. Moved to France 2 years ago, watching in the USA. Awesome. Yes, I'm from the US as well. From LA, that's insane. Texas. I was just in Texas. Where's Elvis? Elvie! I don't know where he went. He left, but he was complaining that I was talking to you guys, not him. But if he comes in the room, I'll put him up there. Let's see. Yes, let me see if I can get him in here. Come here, guys. Come here. They're running around. I think Seymour's coming. But if you stick around here, you can see the pets. Oh, yes. Here we go. Oh, no, he ran away. It's okay. Sorry about that, guys. But anyway, I just want to say thank you guys so much. Yes, I do upload these to YouTube. I upload every replay to YouTube. They're linked in my TikTok bio. And then all of my notes for anatomy and physiology are also linked in my TikTok bio. This is pretty much like what they look like if it'll load. But yeah, these are what my notes look like as well. They're also available in my TikTok bio. I do go live pretty much every day covering A&P. I take topic requests on the bottom left corner. This is the first time I've ever had over 1,000 people in the live stream. That is absolutely insane. Carlos, study for the TEAS test. Please. I definitely focus on some of the key concepts here. Make sure you know the systems and their general functions and structures. Make sure you can do some calculations. I know Nurse Chung on YouTube has videos. A lot of people have told me that has helped them a lot for that. I personally have been tutoring anatomy and physiology for the TEAS, so I have more tips related to that, if I can help with that. But I am going to be working on moving that on. Typical cat. Yeah, I know, right? They wanted to be here the whole time, and at the end, they get camera shy. How biology? Yeah, we do some biology, we do some chemistry, we've done psychology. Thank you for being kind throughout the live. Yeah, thank you guys as well. I also do pharmacology as well. I was a pharmacy technician for 4.5 years, and I took medical pharmacology in grad school, and I took medical pharmacology in undergrad. Hello from Wisconsin, that's awesome. Thank you for the refresher. Yeah, my live streams are perfect for HESI and TEAS or A&P class, especially a lot of people come in here that have taken anatomy and physiology in the past, but they don't remember stuff, so they come here and then we help them remember. But yeah, we do microbiology as well sometimes, yep. As well, do I tutor? Yes, my tutoring is full right now, but if you want, reach out to me via the orange. I should put up the thing here that you can reach out to me during it. You can send me a direct message during the live stream. That way I can see all the topic requests. I can see we can talk about tutoring and whatnot. But thank you all so much for being here. If I look over here, I just have my laptop here so I can look at some of the questions. But 155,000 likes. That is absolutely insane, guys. Seriously, that is absolutely nuts. Thank you guys so much for being here. Hello again. I'm Ollie. It truly is nice to meet you all. I just got my master's degree in molecular medicine. I really want to get my PhD. I think now in anatomy education, just like medical education in general, and looking to improve stuff like this. So doing these live streams definitely helps me do that and get practice doing that. So thank you guys for being here. I love doing these. They are my favorite thing in the world. But yeah, these live streams, I just want to make anatomy and physiology like finally click for you. Did I answer your question? What was your question, Dion? I might have missed it. There were a lot of things. I'm studying for medical coding. That's awesome. Yes, medical coding is very fun. Crystal. But if I miss any questions or anything like that, you can either repeat them in the comments or please hit that orange button. I try to go through and I try to answer everybody. I get like hundreds of DMs a day, so I really try to answer everybody. But thank you guys so much for being here. Not a student, but this is awesome. Thank you. Thank you. I don't find a response. Okay, I'll take a look at it. I'll take a look. Sorry, I know I've been trying to get to everybody. I've just had so many people, so I try to like do some at the beginning of the day and the end of the day. But yeah, I have like 100 DMs that I still need to get back to. But yeah. So sorry about this. Thank you for your patience, though. I really am trying to get to everybody. I try to answer everybody. I love connecting with you all. So I'm definitely trying to talk and get into contact. I did not today. Okay. Yeah, like I said, I will get to it. I will get to it. Just be patient. I promise I am not ignoring your messages and whatnot. Currently in my last generals, preparing for this TEAS. It's so nice to get through. Awesome. Yeah, no, thanks for being here. No, thank you, eBears. Hello, I just found you to also go over some chem. Yes, I do go over chem as well. What was it? Mama Agni. So basically just send me a message via that orange button. Let me know what kind of chem topics you want to see. I'll throw questions in there as well. Yeah, take your time. I'll get to when I get. Yeah, no, I promise. I feel bad because I started taking messages and answering people, but I've got a lot, which is a good problem to have. I have a lot of messages because I do like doing it. But yeah. I don't think I would sleep if I answered every single DM that came in. Yes, you can request some specific anatomy things for the MK. Yes, Morgan, you absolutely can. I would definitely start including them. I had like a lot of the questions in today's live were what has been requested, and especially the questions at the end of the live stream today. Those were kind of the majority. I take the majority, so I go through all the messages, and I write down. Do I have anything specifically for the TEAS? I am actually releasing an ebook very shortly. I will make a note of. I will pretty much I'll let you guys know. I'll put out an announcement on my thing. I'm making an ebook for anatomy and physiology for the HESI and TEAS. It's basically like it's study tips, like how to study, like test management techniques, and then every single anatomy and physiology topic that you would see. Basically, in each chapter, it goes over how to go over that information in each chapter, and then it kind of gives you like notes for that specifically. So that's going to be coming out kind of soonish. I've been making some visuals for it. I'm kind of a perfectionist, so every time I think I finish it and I look back, I'm like, oh, I could add this or I could do this. So I've been but I'll put an announcement out. What's the best way to study anatomy and physiology? This is amazing. Thank you, Casey. What's the best way to study anatomy and physiology? The best way to study anatomy and physiology. So anatomy and physiology, they are kind of separate. They are together but separate. Can you use your current content for the TEAS? Yes, you can. Yes, it will help. It might go in a little more depth. They're out here. They won't come in specifically. Now that I want them to come in, they won't come in. Maybe here in like a minute or so, I'll run out there and grab them. But anatomy and physiology together but separate, right? They work together, but anatomy is what things are and where things are. For what things are, I would use flashcards, right? I would practice the terms, learn your terms. When it comes to where things are, practice labeling. Practice labeling. Basically, take every single diagram from your lab, from your lecture, from your textbook, make them blank. Practice. I use a rule of 5 whenever I go through labeling. I kind of explained that. I just posted a video on the skeletal system that kind of went over that, where I pretty much everything that I needed to label, I make a list of all the stuff I have to label and their landmarks and stuff, and I start with 5. So I will go through 5 at a time. I will ace those 5. I will do another set of 5, and then once I get these 5 right, I add them to my other set of 5, so now I have 10. Mixing them up, obviously, as we're going on, so we're not getting order bias. And then once you get those 10 right together, you add another 5, and then you just keep going until you can get them all. So, honestly, your biggest ops when it comes to labeling is, 1, is not being consistent. You should be consistent with it. B, repetition. If you're not repeating the ones that you are getting wrong, you're not going to get them right. If you keep getting something wrong, you're not just going to magically get it right one day if you don't keep repeating it. And getting it right. Practice. Physiology now. Physiology is processes. All right, it is a step-by-step process. It is like a story. What do you do with stories most of the time? You tell a story, right? Or if you have a process, if you're going to tell someone how to do a job, you are going to explain to them how to do that job. If I was going to ask you, how do I make a peanut butter and jelly sandwich? You're going to tell me, you go grab the bread, you go grab your peanut butter, you go grab your jelly, you open them up, you grab the butter knife, you spread it on, sandwich, and then you eat it. That's the same thing with physiology. Whenever you're going through a process, you want to take each thing and you want to kind of make a flow chart of the steps of these processes. And once you've kind of gone over those steps, practice, explain them out loud like you would explain to me how you make a peanut butter and jelly sandwich. That is how to study anatomy and physiology, right? And that's how you also kind of get into pathology. Remember that physiology is a start to an end, normal, and then you have a pathology, like a disease or something. Somewhere along that chain of events is what a pathology is going to affect. And then you see where it affects, and then you can take a look at where that might affect it later on in the pathway. What causes it, what happens, and then what's the result of that dysfunction is essentially how you can incorporate pathology into that as well. I explained things so well, thank you. But yeah, that's essentially how you study anatomy and physiology. So please, if I missed your question or anything, please feel free to repeat. On Monday, any tips? Let me see here. If I missed any questions, I apologize. I'm definitely try to get everything. Tips for studying microbiology. I can give some tips in a video. My medical school. So I actually just finished my master's degree in molecular medicine. I did research specifically in cancer, urinary bladder cancer, and then lung cell cancer. I want to get my PhD, either in medical education, like anatomy education. What time do I go live every day? So tomorrow is going to be 12 p.m. Eastern Standard Time. Next week I'm going to go live, definitely for sure, Monday through Thursday, and that's going to be at 3 p.m. Eastern Standard Time. I'm going to post a schedule. Also, if you go to my profile, it'll say like live events scheduled, kind of like in the bottom of my bio, it'll say like live events scheduled. See you tomorrow, Chica Red at 12 p.m. Awesome. See you guys tomorrow. Any topic requests for tomorrow, please put them in the orange button there in the bottom left corner. But yeah, no, thank you guys so much for joining the live stream today. This is kind of the end of it. This is the first time I've ever had over 1,000 people in a live stream, so that is insane. But yeah, no, we got to like 1.8 thousand people in the live at one point, which it blows my mind. So seriously, thank you for being a part of that today. Thank you. See you tomorrow, Mitzi. You're doing this for retained info. Thank you. Thank you. You guys are the best as well. One thing I'll never forget is action potentials. Oh, that one took, yeah. I did make a video on action potentials. I'll probably make another one here shortly. I love action potentials. I think they're very interesting. So next week will be 3 p.m. Tomorrow is going to be 12 p.m. Eastern Standard Time. Then I'm going to be on my way back home. So I'm going to be traveling right afterwards. But yes, let's see real quick. Hello. You're so scared. I don't know why you're so scared all of a sudden. Let's see if I can get... Cats are here, but they're just too shy. Gotta meet that threshold. Yes, exactly. You have to meet that threshold. Am I teaching tomorrow? Yes, 12 p.m. Eastern Standard Time. Send some topic requests in the bottom left corner there for AMP. Let's see if I can get this guy. Come here. Hold on, guys. I'll go get them. Seymour is hungry, but Elvis is pretty content. This is Elvis. This is Elvis. They are very hungry and hangry right now. It's time for them to eat a little bit. But this is Elvis. Thank you for sharing. Yes, no, thank you guys for being here. This is Elvis. He's mischievous. He's very mischievous, but he is adorable. Yes, this is Elvis, everybody, if you have not met them. And then there's also Seymour. Seymour is here. Let's see if he'll join us. Come here. No, he's too hungry. Once he gets hungry, he doesn't want to get touched. He's like, don't touch me, I'm hungry. Same eyes. Oh, hi, Michelle. Nice to see you again. How are you? I hope you're doing well. I passed my TEAS. Your videos help so much. Awesome, Chris. Congratulations. Seriously, that is awesome. Congratulations. That is awesome. Thank you so much for sharing that. That's incredible. I'm glad that my videos were able to help in any way. Thank you for letting me know. I appreciate that. That makes my day. I always love hearing those. I get a lot of messages every day about that stuff, and oh my god, it makes my day. But anything else quick? I am going to get going here. I do have to get going. But anything just really quickly that I can answer? We got up to like 162,000 likes on the live stream today. That is insane. Hi, Elvis and Seymour. Thank you, Claudia. Yeah, I know Seymour won't. I'll see. Give me 1 second. Seymour, come say hello. Come here. This is Seymour. He's not very happy because he's very hungry. But this is Seymour. He is adorable as well. Lay low. If you have not seen Seymour before, go ahead. Go ahead. They'll get treats after the live stream. My cat's name is Ollie. You know what? I get that a lot. A lot of people are always telling me that their cat's name is Ollie. It's a common name. Yeah, Seymour. Yeah, he's adorable. Yeah, he's an adorable guy, but he is quite the beggar for food. I have a test on June 28th. Good luck on your test, Carhimo. Awesome. See, now he comes back in here. Now I bring him in here, and he's like, oh, yeah, like, I want to be a part of this now. I am going to get going, but thank you again. So, again, I seriously, I feel like I'm a broken record, but thank you so much for being here. I absolutely love doing these live streams. Again, nice to meet you. Your dog's name is Bella. Yeah, right? Yeah, I worked in a pharmacy for 4.5 years, and, like, every person who they were picking up medication for their dog, the name was like Bella. Same thing with Ollie with a cat. So it was like, people were like, "Oh, do people call you Ollie?" Because my name is Oliver, and I'm like, "Yeah." I'm like, "Oh, my cat's name is Ollie." I'm like, that checks out. It's always they're always like tabby cats too. But seriously, thank you all so much for being here. I absolutely love doing these live streams. I'll be live again tomorrow at 12 p.m. Eastern Standard Time. But yeah, we'll be going over anatomy and physiology. I really just want to make things click for you guys. Is it the first? Okay, gotcha. I will take a look. What's the name? Okay, I will try to answer you first if it's been a while, so I can see what you've said. I will get to you. But again, thank you guys so much. I hope to see you tomorrow or in a future live stream. Thank you all so much. Again, I just want to make things click for you for anatomy and physiology. I want it to finally make sense for you guys. Or if you've taken it in the past, and you just don't remember it and stuff, I'm here to help you remember it, essentially, so you can continue doing on with whatever. Or if you're just interested in learning about the human body in general, the human body is a wonderful thing. New follower, I need this. Thank you, Cal. Thank you so much for being here. Thank you for following. I appreciate it. That is awesome. Thank you. You're here kind of at the end, but I normally do practice tests and stuff and kind of go over anatomy and physiology, so the replay will be on YouTube, but again, I'll be here tomorrow at 12 p.m. Eastern Standard Time. I'll put the thing on my YouTube bio thing. But yes, I hope to see you all in a future live stream, or tomorrow or anything. Thank you guys so much for being here. Seriously, from the bottom of my heart, thank you. This is so much fun to do. Thank you guys so much.